Dartmouth-Hitchcock Health is a small health system up in northern New Hampshire. They have some physician practices down in southern New Hampshire as well, but it's a very rural area. They're an academic medical center, a National Cancer Institute as well, the only level 1 trauma center in New Hampshire. And their real mission is really to make sure that the rural communities of New Hampshire and Vermont have the service that they can provide through those health centers. We have a retail pharmacy inside the health center itself that actually provides discounted prescriptions to those who don't have prescription coverage. We've been able to actually supply a grant to a neighboring community to support their substance abuse program. We've also been able to put substance abuse counselors in our ED to actually see patients at the front end when they come in and to support them long term after they leave the ED after overdoses. And we've been able to actually draw those savings and the funding of those programs back to the 340B program. Mary Hitchcock Memorial Hospital, which is the covered entity, actually gets about $45 million a year in value from the 340B program. And they're actually able to use those dollars to fund our charity programs and our indigent care, as well as our uncompensated Medicaid, which amount to almost $130 million a year. So it certainly helps us to make a dent in the amount of care that we provide for free to our patients. Margins right now in healthcare are razor thin, and we actually had a year where we lost $13 million against our bottom line. Now we've actually grown our 340B program over that time from about $25 million in value to this year I think we're going to hit $45 million in value. And we actually, this next year, as we grew this program, we actually came back with a positive margin. So really, when you start to think about taking those savings away that we're able to realize through the 340B program, we're talking about what services would we have to cut to maintain either a cost neutral or a positive margin going forward. At the end of the day, we have to pay our physicians, we have to pay our nurses, we have to pay our healthcare programs, and if we can't do that, we have to scale back the programs that we provide.